Hello there, Peterborough. Thank you for joining me today on this live. We're going to discuss fall viruses and vaccines. I'll give it a moment to get started, but please feel free to add questions that you might have into the chat and look forward to the conversation today. We're going to cover a whole range of issues, and I'll be happy to take some questions if there's any that come up live as well. Okay, seeing some folks joining, and that's great. We'll get started now. Hopefully you can hear me okay, and feel free to add any questions as we go into the chat here. Today we're going to talk about viruses and vaccines and preparing for the fall. It is September 3rd, the first week back to school for some, right after Labor Day, and perhaps back to work and getting busier into the fall for others. I hope you're well. I hope you had a fantastic summer. I certainly did. I had some time off and had the fortune of being able to explore the beautiful, lakes on canoe and doing some camping in the region. Really beautiful area here in Peterborough. So we're going to talk a little bit about viruses and some of the vaccines for them. So we'll cover off, obviously, COVID-19, influenza, RSV. We'll also talk a little bit about pertussis, which unfortunately is making a comeback this year. And we'll also talk a little bit about some of the other preventions beyond vaccines that you can take, as well as covering off perhaps some information and questions about some viruses that you don't hear a lot about, because fortunately we're not seeing now but are in the media. Things like Mpox and H5N1, so we'll talk a little bit about that. And again, I'll take any questions. I see one that's popped up there, and I'll note that one and come back to it shortly as we go. So the position that we're in headed into the fall is fairly similar to the last couple of years. If we take a look at the Peterborough Public Health COVID-19 Risk Index, which is available if you just go to peterboroughpublichealth.ca, link there on the homepage. The risk index is our dashboard for outlining the current transmission risk of different viruses. And when we take a look here, I'll pull it up for you, we can see that COVID-19 is at moderate, and other respiratory viruses, which would include things like influenza, RSV, are at very low right now. That's pretty typical. Over the last month, we actually did see some summertime transmission of COVID-19. That's why the risk index is at moderate and has been for a number of weeks now. We are able to continue to look at the wastewater signal, and that work reporting on the wastewater signal of COVID will continue. When I look, we had a peak around early August with more transmission this past summer than we had last summer. What that tells me is that we will likely, as we've seen so far in the COVID-19 pandemic, see another wave in a few months from now. Last year, there was a large transmission that started in mid-September. This year, my guess would be it might be a little bit later. We would see some more transmission, perhaps later October, November, because of this summer wave or summer heightened transmission that we've seen. So I think that is a good thing, because there will be the opportunity to get vaccinated and protected before COVID-19 transmission increases more again this fall. On the COVID-19 vaccine front, we know south of the border in the States, they've had their 3 vaccines, the one that's produced by Moderna, Pfizer, and the Novavax vaccine, which is the protein-based one, approved now for a couple of weeks. We're still waiting on approval in Canada. That happens at a national level by Health Canada. Those vaccines will be approved this year, and then provinces will make their recommendations and campaign accordingly. We do know, though, for COVID that generally what to expect, and that is from the National Advisory Committee on Immunizations. So NACI put out their recommendations now back in May, and their recommendations were quite similar to last year, being that they strongly recommend a dose in populations at higher risk of severe COVID-19. And they recommend consideration or a conditional recommendation of a dose for others. So that recommendation for severe COVID-19 includes anyone that has not yet been immunized at all against COVID-19. It also includes people who are residents of long-term care homes, other congregate living settings, people with medical conditions that place them at higher risk, people who are pregnant, First Nation, Métis, Inuit communities, people that are members of racialized or other equity-deserving communities, and people who provide access to essential community services. So that population is strongly recommended, and the way NACI frames it is others that have been previously vaccinated are recommended to have access and receive. So I think that people will obviously make their own decisions. I certainly will be getting my own vaccination this fall. That'll probably be with one of these mRNA vaccines that are produced by either Pfizer or Moderna, and they're nicely tailored to the latest variant that's circulating. So that's called, for those still tracking, KP2, and for currently circulating strains, most of the COVID that we're seeing out there is what's called KP3, and that's just a descendant. So the vaccines that will be available for COVID this fall should actually really be good protection. So that's important, and I'm sure folks will want access to that. I don't know exactly when that will start in Ontario yet at this stage. We're still waiting for that final information, hoping to find out in the next couple of weeks from the province when that vaccine will be available, probably early October. And here in the Peterborough Public Health region, for the most part, people will get access to that from their pharmacies again, just like last fall. Peterborough Public Health running some selective clinics. That includes for First Nation communities. We're also doing for those who can't access otherwise, including younger people in our routine immunization clinic here. So information about those fairly limited clinics will be available when we get the provincial guidance. And for the most part, people will be able to get their vaccine from pharmacies. Similar story goes for influenza. We're anticipating information fairly soon about the vaccines that will be available. We know that Australia has had one of their most severe flu seasons in the last decade this past summer, right? So Southern Hemisphere, our summer is their winter when they get their influenza wave. And it was quite severe in the Southern Hemisphere this year. So we would usually anticipate that ours will kind of follow suit and be similar. So I think it's safe to say that we're likely to anticipate a more severe flu season this year. And for that reason, again, those that are eligible, which is everyone 6 months and older, should be getting their flu shot. Flu shot's really important for everyone, but especially for those at severe risk of severe influenza, which includes the elderly and young children. Children under especially 10 years of age are at risk of severe influenza. Certainly my kiddos will be getting their flu shots as well this year, and it's really important protection. We do see kids die from influenza. For the most part, adults that get it have a lower likelihood, if they're otherwise healthy, of severe disease. But, who wants to be floored with the flu? So I think important to consider rolling up your sleeve when that program starts. Again, we would anticipate late September, October, as in previous years, influenza vaccine should start. Okay, moving along to RSV. Respiratory syncytial virus, RSV, is a virus that is what's called a respiratory virus as well. It's an important one, and it causes a lot of hospitalization and severe disease, especially in infants, young kids, and in the elderly. So for the first time last year, we actually had a provincial program that was available to prevent RSV in high-risk older adults. And that was using one of these new RSV vaccines. called Arexvy, and that vaccine will be available again this year. But there's also a new RSV vaccine that's available called Abrysvo, and that vaccine is also authorized for older adults, but that vaccine will also be available for people who are pregnant for protection of their kids. We'll come back to that shortly because even more exciting will be what the province has announced, this new vaccine for infants that is going to be very important protection, because when we see kids admitted to hospital with severe respiratory illness, especially through the winter, often it's because of RSV, and this vaccine that's going to be available to protect them will be really important. So on RSV, the population that is eligible for this are those who didn't get it last year, because if you got it last year, you're likely protected for multiple years. So we're not strongly recommending people then get the vaccine again this year. Those who are eligible for the provincially funded program are anyone 60 years and older that's living in a long-term care or retirement home, and then other key populations. So people who are in hospital and staying there under what's called alternate level of care, people on dialysis, Indigenous populations, people who have been the recipients of transplant, and then people who are experiencing homelessness, all of those for people 60 years and older. Now, if you are not in that group, you could also qualify, if you're in that age group but not in the high-risk group, to purchase the vaccine yourself, but it's not something we're strongly recommending because the vaccine in the publicly funded program is going to be covering off those who are at the highest risk of severe disease with RSV. Let's talk about the infant program. That's exciting. There's a vaccine, the name of it is Beyfortus, but it's this new monoclonal antibody vaccine. We've had a similar monoclonal antibody available for preemie babies for a number of years, but this is a new vaccine that's now going to be much more widely available for all newborns. And if you're pregnant and going to have a kiddo in the next 6 months through the winter, you will actually receive information from the hospital about getting protection for your infant through this. And this is an exciting new opportunity to protect infants and young kids at the highest risk of RSV and hospitalization due to that virus. So you'll be given more information either through your family doc or through the hospital, your midwife or obstetrician, about the availability of this as we go into the fall and it becomes available. But it's a new, well-studied, safe vaccine, but new exciting source of protection that you'll want to keep a lookout for. I want to briefly talk about a few other infections. One, not a virus, is pertussis, a bacteria that causes whooping cough. So unfortunately, we are seeing a resurgence in whooping cough, and the transmission of that has been especially in people who haven't had their booster dose in the period that they should ideally be getting it. So the vaccine that protects against pertussis is given to infants when you're 2, 4, 6 months old. It's also given to 4 to 6-year-old kids and to 14 to 16-year-old teenagers. And most of the cases that we're seeing are in that teenage population who haven't had their booster dose in the time that they should be. So last school year, we actually saw a number of outbreaks in schools. It can cause this very distinctive whooping-like cough where people gasp for breath and have this prolonged difficulty coughing. It can cause severe disease, and what we're most concerned about with pertussis, again, is infants can get severe disease and or die from pertussis. So getting them their vaccines while they're young is important. But for everyone, protection against this is important. So we would recommend, especially if you're the parent of a teenager, check your vaccine records, check with your family doctor, make sure you're up to date. If not, public health is doing catch-up clinics. You can see your primary care provider, and we'll even be doing some vaccine clinics in schools to catch people up. So keep an eye out for that. Protect yourself against pertussis. It's on the resurgence, as is a number of other vaccines, and it's because we've fallen behind on some of our immunizations, which is unfortunate. So it's important to catch up on those. A couple more viruses to just touch on. One is, they're both ones that we continue to watch, so not anything to be urgently concerned about. in our community at this moment, but ones that public health are watching. One is H5N1, which is avian influenza. You'll recall earlier in the year we saw a bunch of outbreaks of this in cattle farms and dairy farms, especially in the United States. And we saw several cases in dairy farm workers. The cases were not as severe, but the reason that we're on the lookout and watching this is because historically avian influenza has been very, very severe. You know, a lethality that is 50 to 90% in some of the outbreaks that have happened since this first emerged a little over 2 decades ago. So historically, this virus has been a big concern, and it's in a new population, animal population, being dairy cattle. To watch this, public health's been investigating the cases in the United States. We've been monitoring for cases in Canada, and to date, we haven't had any positive cases in cattle in Canada or in the milk supply in Canada. But this is very much something that we continue to watch. If it were to happen, some of the same preventions that have worked for COVID influenza would work for protecting and stopping the transmission, including things like masking and improved indoor air quality. But importantly, there is a vaccine that could be available and ramped up and distributed if this were to occur. It's not something we're routinely recommending because at this stage we haven't seen any cases in Canada. So it's one we're watching. Another one we're watching is Mpox. You may or may not have remembered back in 2022 we saw a global pandemic of Mpox. Well, that virus has continued to transmit in some countries, especially in Central Africa. Actually, one of the countries that I used to work in, Democratic Republic of the Congo, is seeing large outbreaks of a strain of that Mpox that is more severe. That's something that, again, public health is watching. There was an international pandemic emergency declared by the WHO, especially because those countries don't have access to the same resources and protections, and they need access to the vaccine to prevent the outbreak that's ongoing. At this stage, there's been a case in Europe, but haven't been cases in Canada, but of the more severe strain, but it's something we continue to watch. And if it were to happen, it would be certainly a concern, as it's a concern in the DR Congo right now. I mean, it's really unfortunate that we continue to see kind of the unfairness in access to health services and protections globally, because really in this globalized world, our health is all connected. Viruses don't respect borders. So again, I just bring it up to say it's one that public health's watching. For some populations, especially people who are in the MSM, men who have sex with men population, or sex working population, there's eligibility for the vaccine against Mpox. And you should check that out if you are in that population and you haven't been previously immunized. It's a safe and effective vaccine, but at this stage, it's really only for that focused population. We're not recommending it for everyone. We're not recommending it for travel, but public health is continuing to watch it. So those are most of the viruses, plus one bonus, pertussis, that I had wanted to cover off in our discussion today. Hopefully I've covered off most of the information that you were maybe looking for. I will also emphasize, we're going to continue to publish the risk index. So on peterborough.ca/COVID-19 risk index, we can continue to follow the emergence of viruses as we go through the fall. We are generally in a far better place than we've been, obviously, in the earlier phases of the pandemic. Though COVID's still here, we're fortunately seeing better protection from vaccines and, for the most part, less severe disease. Though I want to say, we've had 14 people die in our community in 2024 from COVID. So it is still a virus that's presenting with severe disease, and that's a lot more people than we'd ever see on an annual basis die of influenza before the pandemic, right? So this is important, but for the most part, for most people, severe disease is less likely. We know there is a lot of people that continue to be affected by long COVID or post-COVID condition. I'm actually helping and involved in guidelines called the Canadian Post-COVID Condition Guidelines. You can learn more about them at canpcc.ca. And that group continues to monitor for evidence and make recommendations to prevent post-COVID, which is important. If you're trying to be protective, some things to think about beyond vaccines that we've talked about are potentially masking, especially when the risk goes up to high, very high. Masking, I know not commonly used anymore, is still a helpful intervention. So if you don't want to get sick, if you're in some place with super bad air quality, it's important to think about masking as a way to prevent. If you're homesick and you've had COVID, the recommendations are still to use masking to prevent transmission of COVID for the 10 days after you do go back to work after you've been sick. So think about that if you are sick. Especially to improvements on indoor air quality. That's something that our Board of Health has really advocated. And you can improve indoor air quality by spending more time outside or with windows or doors open. Look at your furnace and make sure the settings, especially when you have lots of people over, are high to get lots of fresh air inside. We know that's healthy for more than just virus transmission prevention. We know better air quality, more oxygen actually helps us to concentrate and feel better. So indoor air quality is still something I think is super important to be aware of. And I'll pretty well stop my general update there. I'm going to cycle back to a question that came from somebody earlier in the chat, which is there any updated guidance you can recommend for congregate living facilities headed into the fall? So I know our health unit will be in touch directly with those settings. Be thinking about vaccine for those residents of congregate living settings, so especially COVID and flu for everyone, but RSV for those that qualify as well. So there's lots of vaccines that'll be important. Continuing to try to prevent the spread through things like masking, trying to protect folks when there's people that are sick and, staying a bit more isolated. We want to make sure people don't get socially isolated, disconnected, but we also want to make sure people don't spread viruses. Thinking about air quality is important as well. So the guidance that we have for those settings will be shared directly from our teams. You can also check out our website for more information on that. You can click through the risk index here. Down here you can see guidance as well, and there's some information that may be helpful for you in answering your questions there. So I've spoken fairly quickly. For those of you watching live, thank you for joining. For those of you watching the recording, I hope this has been helpful. Feel free to reach out if we can help further. I'm seeing a thank you for all this information. I'm just going to wait for another minute or two in case there's more questions. I know a couple that we got in online beforehand. Let me just turn to those. We got one question, will we be holding vaccine clinics? And I think I've covered that off already, right? So our routine immunization clinic, for the most part, focuses on kids who don't have access to primary care to get caught up on vaccines. We will do Mpox vaccination there as well, and public health will be hosting some focus clinics for influenza and COVID vaccine. But for the most part, most people will get their vaccines this year through pharmacies. I believe we have already 44 pharmacies in the region that are signed up and going to be participating, so hopefully you can get your vaccine at your pharmacy. Again, if you missed it earlier, we're hoping that end of September, early October, those will be available, but you may want to just stay tuned for those final dates. And one other question we did get, can you please advocate for the updated Novavax shot? So Novavax, just for those of you still interested, or if you're interested in that question, is a protein-based vaccine. So it's an alternate to the mRNA vaccines like Pfizer and Moderna. You'll remember those names maybe. It's been a good vaccine, and it's a safe and effective vaccine. The one that they have this year is not as tailored to the KP3 strains that are kind of circulating. It's been authorized in the States, and it may be authorized in the Canadian context. Now, we haven't gotten the guidance yet, so I don't know for sure, but it has been rumored that we won't have access in Canada to Novavax vaccine. I think that will be a little bit challenging for those who have accessed that vaccine before. Some people have an allergy or can't get the mRNA vaccines, and that's been a good alternative for them. What I will say is every year procurement of vaccines is a complex process that the governments, usually provincial governments, but in the case of COVID, the federal government's really led, undertakes. And I know there's a lot of factors that go into decisions on procurement. So I'm sure there's been lots of thinking and thought to that in the decisions that are made. In other vaccines, sometimes one brand or one version or another has to be prioritized just because of either budgets or other procurement related decisions. So I'm sure that the folks that are working on this have been trying really hard and putting a lot of thought into it. Unfortunately, I don't have more info to add on Novavax specifically. So with that, I will thank those of you. Yep, a few more thank yous in the chat there. Thanks so much for joining. Feel free to share this with friends, family, colleagues that may have questions as well. And again, stay tuned for the precise go live dates on COVID and flu vaccines. I'm hopeful that we'll get information soon. And also, since we have seen some COVID through the summer, hopefully it'll abate a little bit so that once we get vaccinating with COVID, there'll be plenty of time for people to get protected before we see, an increase again, which has happened to be every 3 or 4 months in the last 5 years of COVID here, 4 years of COVID. So hopefully that protection will be in place by then. So with that, I'll say thanks for joining. I hope you have a wonderful rest of your Tuesday and a good transition back to fall. For those of you with little kiddos like me going into school, I hope it is a smooth, good, healthy, safe transition. And we will talk soon. Please feel free to reach out if there's more questions or anything we can help with. Take care. Bye.